There's three things that I want to accomplish today. I want to tell you a little bit about Docphin. I want to talk to you a little bit about our recent traction, our launch. And I also have an exciting announcement to make that we're launching a new product, I guess you could call it. I'll give you a little sneak peek of that. So Docphin is the, as you said, the Bloomberg for doctors. And one of the main reasons that we started Docphin is all transparency. I'm not a doctor, but my two co-founders are doctors, and they've dealt with sort of the find problem in medicine for over a decade of doing research. And what we fundamentally believe that there's really not a search problem in medicine, but there is that find problem, and it's really tough and frustrating for physicians to find the medical research that is relevant to them and their patients. And that's where we set out to start Docphin. So just to give you a good introduction, I'm going to show you a little video, and it's right here.
Meet Andy, a resident who's well on his way to becoming a practicing physician. And hey, he's earned it. He's been through the ringer, cramming for boards, stressful call nights, and exhausting clinic days. Throughout it all, Andy's done his best to stay informed of the latest medical news and research. But the reality is that it can be difficult for Andy to keep track of it all. Here's the problem. Andy, like most physicians, gets his journals by regular mail or email reminders. Sometimes it's weekly, other times monthly, but always at different times. On top of that, Andy also follows topics he's interested in by reading news like the New York Times or CNN. And after all that searching, he usually only finds a few articles that are actually meaningful. A bit frustrated, Andy looked for an easier way to keep up. Social networks make him do more work by having to post the content. Andy simply didn't have time for that. Email reminders felt like spam and clogged up his inbox, and some websites have summaries of studies, but Andy wanted to read the actual article. Then a friend told Andy about Docphin, a free website that lets physicians personalize medical news and research in seconds. Okay, it works like this. First, Andy chooses his favorite journals and news sources. Docphin then creates a personalized page that is simple and easy to use. Andy can then sort articles by most recent, most viewed, or most commented. He can also use keywords to focus on specific topics. No summaries or rewritten content. Docphin takes you directly to the source. And that's not all. Docphin allows Andy to easily share articles with others. Or if he's short on time, Andy can save articles to his favorites and read them later. And hey, if Andy wants to know what others think about an article, he can start a discussion by posting a comment. Say it's simple. Now Andy can focus on what's important without falling behind. Andy's better informed, which is good for his patients, and he has a lot more free time, which is good for Andy. Join Andy and stop wasting hours searching. Find what you've been looking for at docphin.com.
So we launched on November 14th at 3 beta sites: the University of Michigan, the University of Pennsylvania, and the University of California, San Diego. So it's in about 2 months ago. We just sent about 300 emails to residents that we knew at those beta sites. And within a week, we had over 1,000 registered users on the site, spanning the entire spectrum of physicians and non-physicians too. And we were featured in TechCrunch. We were covered by all over the university newspapers. And we really got an overwhelming response from not only physicians, but also potential sponsors, partners, advertisers, and investors. Some of the specific feedback that we got was that, like I said, we had a pretty even breakdown of physicians that are practicing physicians all the way down to medical students. And people said that, it's revolutionized the way that they review journals. People really echoed that it really solved that find problem in medical research. And, especially for medical students, they said that it really enhanced their learning. So that kind of feedback really kind of drives us as a team, really reinforces and validates what we created and the fact that we really think we solved a very big problem in medical research. And it's really kept us going forward, and we're very excited to sort of keep the momentum up in 2012. Across the board, the feedback that we have been getting is that doctors want this in the palm of their hands. And it's all about really translating that research from the bench to the bedside. And they really want this on the go with them while they're treating patients and while they're, just that it really aligns with what their life is like, in the hospital. So we're really excited to sort of use this forum to announce that we are going mobile. We're announcing our iPhone app, and it's going to come. It's not out yet, but it's coming out soon. But for you guys, we have a little sneak peek of its basic functionality and what it's going to look like. So I'm just going to show you another video. Basically, what we try to do with the iPhone app is we really try to preserve the simplicity of the app, of the website in general. So here you have your 4 main pages. You go to your My page, which is where you personalize your sources. So you say you click the New England Journal of Medicine, you get to see all of the latest New England Journal of Medicine articles. You can filter how you want, most recent, most commented, most viewed. And then you can go on and you can sort of pick the article that you want to read. And when you do, you get the title, you get the abstract for free, and then it will give you the option to view the full article from the original source. You can comment it, you can share it, you can like it, you can save it to your favorites. So now going into the My Favorites page, this is a favorite item for doctors because they don't necessarily have the time to read the articles. So this is where you get to see the ones that you want to read in one place. We have about 30 specialties on Docphin, over 250 journal sources right now, and we're continuing to expand. And then this is our Twitter feed as well. So doctors equate this to like their finance professional stock ticker, and it's a way for them to get a quick pulse and find out what's going on in their specialty. So that's the iPhone app that we're launching soon, and happy to answer any questions now.